If your back feels stiff when you first wake up in the morning, you are not alone. And it is not just age. I'm Dr. Matao Jamee, a physical therapist who has worked with adults. One of the most common things I hear is this: those first few steps out of bed are the worst part of my day. If that sounds familiar, this 1-minute wall exercise was made for you. No equipment, no floor work, just a wall. Stand with your back against a wall. Place your feet a few inches forward. Let your head and shoulders rest gently on the wall. Now, slowly pull your chin straight back. Not down, straight back. Hold it. 1, 2, 3. And relax. I know this looks simple. That is exactly the point. Now, raise your arms. Slowly slide them up the wall, only as far as is comfortable. Then bring them back down. No forcing, no pain, just easy movement. Let us do 5 together. Take a breath first. Ready? Slide up and down. That's 1. Nice and slow. Up and down. 2. Keep breathing. 3. You're doing well. 4. Last one. 5. Now just stand there for a moment. Take a slow, easy breath. Notice how your shoulders feel. Notice your upper back. Most people feel a real difference after just one set. So why does something this gentle actually help? During sleep, your spine stays in one position for 6, 7, 8 hours. Your muscles relax, your joints move less, and the soft tissues around your spine temporarily tighten up. That's why those first few steps feel so stiff. It's not weakness, it's biology. The wall helps guide your body back into proper alignment. The chin movement reactivates the small muscles that support your neck and upper spine, and the arm slides encourage gentle motion through the shoulders and upper back. Together, they help your body make that transition from sleeping posture to standing posture. I had a patient, 71 years old, retired nurse. She told me she had stopped going downstairs before 9 in the morning because the stiffness was so uncomfortable. She started doing this every morning at the side of her bed. 2 weeks later, she said to me, "I had forgotten what it felt like to just walk normally when I got up." That's what we're working towards. Not miracles, just mornings that feel a little more like you. One of the most common mistakes I see is rushing. People wake up and within minutes they're bending forward, lifting things, or moving suddenly before their spine has had a chance to wake up properly. That's often when discomfort gets worse. Your spine needs gentle movement before it needs work. Think of it like a car on a cold morning. You wouldn't push it hard straight away. A little warm-up makes everything run more smoothly. What most people notice first is not dramatic. It's the small things. Standing up without that familiar wince. Walking to the kitchen without reaching for the wall. Feeling a little more like themselves in those first minutes. And that matters more than people realize, because when movement feels easier, people move more. And consistent, gentle movement is one of the most powerful things you can do for healthy aging. Here's something I'd like you to try. Do this wall reset every morning for the next 7 days. 1 minute, that's all. Then pay attention to how your back feels when you first stand up. Small changes done consistently often make a bigger difference than people expect. I have a question for you. Does your stiffness tend to be worse after sleeping, or does it come on after sitting for a long time? Or is it more when you've been walking? Leave your answer in the comments below. Your answer will help me decide what to cover next. If this was useful, I share simple movement exercises every week. Nothing complicated, nothing that needs equipment, just straightforward movement that works for real people over 60. Take care of your spine. Take care of how you move every day, and I'll see you in the next video.